The comprehensive care team is the best way to take care of people with multiple sclerosis and the various problems they can encounter. In the next talk, Dr. Scott Newsom, Nurse June Halper, and physical therapist Patty Bobrick will discuss how the different members of the MS care team can best maximize outcomes better than any one of them can do alone.
Thank you for joining us today for MS Teams. Thank you, June and Patty. This should be a very exciting panel of discussions and answering some really great questions. And so I'll start with you, June, first.
Sure.
So what, in your mind, are the benefits of an MS team, and does an MS team and care team specifically have to be sort of under the same roof?
Just going back a number of years, the person with MS was very, very isolated, and the benefit of a team as it evolved over the years, actually starting in Canada at a comprehensive care center run by Dr. Donald Patey, gave the patient an opportunity to interact with a number of other people and took the burden off the one person that was trying to manage care. And in that case, of course, it was the neurologist. And the benefits of the team are really quite obvious today because the growth of the centers all over the country, whether they be within one center or what we like to call the center without walls, you know, the community of carers out there, including on the internet. You know, we see so many programs and services that are offered on the web in a virtual way. So Patty, don't you see that with rehab?
Absolutely. From a professional standpoint, you know, we're limited about the time that we can be away from work, from our main job, to go to educational opportunities. So accessing the most current information via webinars or podcasts or any number of, even using Skype to Skype with a professional in another area when you have questions, is really becoming more of the norm than, you know, actually coming to live conferences, which is always positive. And that's filtering down to the patients also, using telemedicine and being able to access, particularly if you're in a rural area and you have no one around you who's doing MS care, that you can access those professionals via the technology we have these days.
Absolutely.
Yeah, no, and I know for myself, working in an academic center where you would think under one roof we would have everything that we needed from an MS care perspective, but we actually don't. Meaning that there are certainly, I'll give an example, like neurourologist where I work, but honestly, I've looked beyond our own walls and found a couple key people that I'll refer patients to because I just like the way that they treat patients, maybe a little bit better than people who are under the same roof.
Also, don't you find that with primary care as well? I mean, not a lot of primary care physicians or even gynecologists in the women's situation, not interested in working with MS and really not familiar. So it's nice to develop a team of people that can, you know, work with you and work with you closely.
Yeah, and especially in, you were mentioning rural areas where maybe you don't have the subspecialty bandwidth that you would need to take care of one patient. And so trying to look for people in maybe your immediate area or outside of your area could be quite helpful and powerful for the person.
Absolutely. You know, we all started somewhere in this field, and we weren't born into it as experts. So finding someone who just has an interest or a background in neurology, who's willing to learn more about MS. If you don't have an MS specialist right in your area, but identifying someone who's willing to learn and be an advocate for you and kind of step up to the plate is really wonderful, because it kind of increases the number of people that are doing MS care and are working in that field.
And I have a question. So getting to the comprehensive care model in MS, and I know what your answers are going to be, but
don't preempt
do you think it's really making a difference in people's lives in terms of not only, you know, as a neurologist in the clinic, we're fixated on what's the MRI show, is this person having a relapse, but that may be different than what the patient really is perceiving for their own quality of life. And so do you think it's making a difference?
Well, in my perspective, from the nursing perspective, absolutely. That we're dealing with a much better informed patient whether their team is within a center or, as we said, center without walls, or even via the internet. And I know the nursing level of care, and I would assume PT, rehab, and even physicians having each other, learning from one another. I think from both ends, it enhances the care in MS. And I think in a sense, it waters down the responsibility of one person trying to do everything for one patient. You know, and it makes the patient's expectations more realistic for you, because they say, well, my neurologist can do this, but I'll ask the nurse, or I'll ask Patty if I'm going for rehab. So I think it is working, because it's a lifetime disease. Randy Shapiro said years ago, MS is a marathon, not a sprint. And there were many times, I remember over the years early on, that patients were said, go home and diagnose and adios, and call me if you have a problem. Yeah. And that model doesn't really exist that much anymore, because patients are smarter.
Yep.
They really are.
Yeah, no, and I actually have patients coming into the clinic now, you know, and it's very humbling as a neurologist for the patient to say, okay, I understand you love MRIs and you love to hear whether I'm having a relapse, but, you know, I think I need some physical therapy based on, you know, their day-to-day activities, maybe their stamina is impaired. Mm-hmm. They need energy conservation techniques, and you know, we see them for a very short window of time in the clinic, and we don't capture really what's happening out in the community. And so I think patients are really helping teach us what the true comprehensive care model is in MS. And from a rehab perspective, you probably
I think that you bring up a really good point, because, well, first of all, you know, none of us in rehab can really think about, I can handle everything by myself too. You know, we depend on the medical, the nursing pieces of this, and we absolutely have to have good communication and good collaboration. But patients want to know what I can do, what I can do besides my medication, the nitty-gritty. Well, how can I exercise? What should that look like? A lot of folks are scared to exercise when they get a diagnosis. Sure. So we can kind of give them the confidence to kind of take charge of that piece of their lives. You know, we do a lot of non-pharmaceutical symptom management, and we're constantly educating and, you know, working with painful syndromes, and you know, we talk about bowel and bladder and sleep habits and nutrition and all of those things. So June, you brought up a good point. No one person, none of us can do that by ourselves. So when you have a team of people, it gets spread over. And then as professionals, we're able to feel more confident and comfortable about the things we're able to do, because you feel kind of inadequate if, like, oh, they have so many needs and I've only met one or two of them, but oh, I know my OT and my speech pathologist is going to join in and help address some of those things that I wasn't able to address.
So with the comprehensive care model in MS that we're trying to really harness, there certainly are barriers out there that could impede our ability to really do high quality comprehensive care. And so June, I'll ask you, what are maybe a couple of the barriers that you see out there right now in 2017? And second to that, what are some of the things that we can do now to try to get over those barriers?
Right. The barriers, of course, first and foremost, are getting paid. I mean, when you're in practice, services need to be reimbursed under a person's insurance, whether it be Medicare, Medicaid, or private insurance. And there are a good number of our patients with no insurance. So that becomes the first big unsurmountable barrier in some situations. So you have to do a lot of fighting and fudging and writing letters of medical necessity and trying to access patients' rights. And of course the other thing is, if like the MS Society or the MS Coalition might offer programs that might enhance certain activities that we can't get supported. That's the one barrier. This other barrier is distance. As you mentioned earlier, both you and Patty, rural areas, transportation, just getting to places. So little by little, I think the web is going to answer a lot of the rehab issues, but hands-on diagnosis or hands-on review of MRI or checking someone's skin or checking their blood work. That sort of needs an in-person visit. So little by little, I think we're trying to solve it, but I don't see those barriers going away very quickly.
Yeah, we're just going to have some creative ways of trying to go around the barriers if you can. And I think with rehab, it's even that much more challenging, when we think about patients who have MS that, okay, they have an acute flare, they get rehab, and then they're done. But we know for a lot of our patients, they really need a maintenance therapy program.
Yep.
And some of our patients can't do that in their own home. And
Right.
so we rely on our rehab colleagues to help us. But there's a huge barrier with maintenance therapy, right?
There is, and insurance is certainly plays into that about payment. The other is that there is a lack of professionals in the true rehab world and in kind of a community fitness world too that don't like to do MS. So they feel it's a chronic illness, so people never get cured, so how much can I really do? And it's really kind of changing that, really a lot of education. We are really in desperate need of more rehab professionals doing MS care. The statistic is that we have about 500,000 PTOT speech pathologists in the US, but we have less than 500 MS certified specialists in North America.
Yeah.
So, being able to really access those people who have expertise. And really it's those of us who are in the area of MS care, it falls on us. We have the responsibility to train the workforce of the future along with the consortium, one of our major missions.
Absolutely.
Right.
Yeah.
So I really feel like we have a huge responsibility to share our knowledge and to bring more people into kind of the fold of the MS world, so that quality care can not only continue but excel in the future.
So how do we get people excited to come into MS, right? So for neurology, sometimes I feel a little bit easier to get people involved because, we have the MRIs that we can look at. We can talk about the patient. Okay, they had an attack, they recovered.
You have a lot of
we have the drugs now
right,
that are really, in my
Yeah.
mind, helping,
Right.
improve the quality of life of people over the long haul. And so we have a lot as a neurologist, say, oh, look, this is great. But I think it's much more challenging when you look at other specialties or subspecialties in trying, especially in the rehab world, or even in sort of nursing, advanced practitioners, and getting them engaged. So how do we do this?
Well, we have the IOMSN, the International Organization of MS Nurses, has brought in, we have over 2,000 members worldwide. We just had a meeting recently. We had a nurse from Lebanon come over. We had a bunch of nurses from Portugal. So it's spreading throughout the world. Keeping them is another issue, though. That's the problem, keeping them interested and excited. So what we're doing actually is we have an active website, we have a listserv, and I think Patty's doing a similar thing with rehab specialists.
Right, with the International Organization of MS Rehab Therapists. I think from my own personal perspective is what I do, and maybe it's one clinician at a time, but I take students, they come in, they get excited about what we do. It's never anything what they have expected. They expect it to be dreary and very mundane, and it's really exciting and creative and a positive experience. So I go out and I teach at the local universities. I try to do the MS unit in the PT schools to kind of get them excited early in their career. So if they see somebody with MS, they go, oh, I remember that professional. Oh, maybe I can contact her and she'll be able to share a little bit more with me.
So talking about getting people excited to go into MS, even though, as I mentioned in neurology, I think we have a lot of things that we can get people interested in to come into neurology and MS in general. But it all depends on your vantage point, right? And so when I attend the wards, most of the people that get admitted are the sick of the sick, especially from an MS perspective.
Sure.
And so, I've heard residents and students say, oh, I don't know why you would ever do this as a career. And of course, if that's all you see, it would be very hard to do that day in and day out. And so what I've told those individuals is like, well, why don't you come to the outpatient setting and let's really see what MS is like. And we're really doing a great job, I think, with the comprehensive care model and MS, that we can treat this now mostly as an outpatient condition.
Sure.
And for the people that have said, okay, I'm going to take you up on that offer, and they've come to the outpatient setting and really see what MS is like, and then get a sense of sort of the multidisciplinary treatment that goes into taking care of one person, we've been able to actually get a lot of people excited and actually switch what they've wanted to do career-wise.
Sure.
And so it really comes down to, you know, what you're exposed to, and so I do echo what you said, that I think the onus is on us
Oh, absolutely.
as a group,
Absolutely.
right? And
But
so-
it's the same thing with the patient, though. When somebody who's newly diagnosed, and you have to do a support group, and you go into the group and you say, you know, how do you feel about MS? Close your eyes and let me say the words MS. What's the first thing that pops into your head? 99.9% it's wheelchair, which in our mind is a tool, but in their mind it's a downhill road to disability. So you have a lot of work to do to get them convinced that the team is the right way to go. We have to empower them, and I think the modeling that we can do, even in ourselves, just being a team, I think for us this is very nourishing. This is very supportive and keeps us in business, so to speak.
And Patty, what would you say to a patient who, even if they're not newly diagnosed, but they've now gone to the next stage of disability, whether it's cane, walker, wheelchair, and you know, how can you get them, it's going to sound sort of a little silly, but get them excited about what their future holds?
Right. Well, sometimes it's a tricky thing to do, and over the years I've kind of learned that people are ready when they're ready, and I can make recommendations and I can show them why things are the way they should be. But if they're not ready to buy in, they're not ready to buy in, you know. So, you know, a lot of times, even though somebody might really benefit from a brace or a cane or something, as long as they're still safe, I don't push it, okay? Because more often than not, 3 months later, they're coming back to me, you know, Patty, that cane you talked about, let's revisit that. The other thing is that, you know, you're reframing. It's all about perspective. So if you're walking and you're looking like your gait looks like you're drunk, and I give you a cane and your walking straightens away, that's a big visual for somebody to say, well, you know what, you're right. It's only a tool to make something better. We're always talking about what the future holds, what could be versus what are we grieving that we've lost. Right. So empowering a person to look forward and not spend their time grieving about what was is an important thing of what we do.
Yeah, being optimistic, right, June? I'm sure when you've seen patients, especially those that may be at a higher disability level, and think about things that they can't do now that they used to do, being as optimistic as possible. And so what are some words of wisdom that you have imparted throughout the years to people?
A team. I do, and it may extend beyond the comprehensive care model to programs like Can Do, you know, which is a team of people that talks about real life living with MS and how you can manage day to day. And of course, again, I can't emphasize the value of the internet. It could also be a great enemy too, depending on what websites they visit. But the idea is not to feel alone with this disease. You know, you've got to feel like somebody cares. And I think we start off caring on a clinical level, but we've got to help people get empowered to find a whole caring network.
And I think that it goes back to the team approach,
right?
Because we all have different, you know, skill sets and different vantage points.
Right.
And I think if we work together as a team, we can help one individual really impact them positively and improve their quality of life.
Plus, we also need a team. I think for us to stay in this field the way many of us have for a long time, if we didn't have each other, I think it would be very difficult. So
it's true. Our teams are around us to encourage us and motivate us and celebrate with us the big stuff and the small stuff.
Yeah.
Absolutely.
And I like the teams without walls. That's
yes.
Well, thank you for joining us today for this wonderful panel. Thank you, June and Patty. We hope this was insightful, and we look forward to more.